Compassion fatigue contributed nearly 20% of the nurses leaving their job at first year of their practice, and 54% is staff turnover. The main takeaway from this project is there is a growing need to improve compassion fatigue and compassion satisfaction among nurses. Implementing brief mindfulness-based intervention improve nurses' coping abilities, reduce perceived stress and anxiety, and preserve caring attitude. Mindfulness-based intervention do not have to be long. It can be brief 5-minute mindfulness-based intervention that added to nurses' shift huddle can reduce compassion fatigue and increase compassion satisfaction. There is so much takeaway. If I get chance to do the same mindfulness-based intervention, I would not only focus to nurses, I would also do for provider for compassion fatigue. It can be anybody, accountant, manager, CEO. We all go through compassion fatigue, and it's really important to participate in mindfulness-based interventions. The surgical trauma unit was converted to designated COVID-19 unit. These nurses were tired, stressed, and burnout. They were not comfortable taking care of the complex patient with new pathophysiology. In addition, nurses' turnover in the surgical unit was high. And we wanted to get control of staff retention during this emergency. This led us to explore a way to mitigate and prevent burnout among surgical trauma nurses. Research suggested that implementing brief mindfulness-based intervention would help our nurses to cope with work-related stress. The Focal 5 is a reliable and validated instrument with 3 subscales that measure burnout, secondary traumatic stress, and compassion satisfaction. The combination of burnout and secondary traumatic stress is equivalent to compassion fatigue. The 30-item instrument uses the 5-point Likert scale, in which 1 indicates never and 5 indicate very often, and then subscale range from 10 to 50. All nurses were invited to complete the Focal 5 questionnaire and demographic information using the electronic platform before the start of intervention and after the intervention. Responses were kept anonymous and confidential, and numeric identification was used to match the pre-intervention and post-intervention questionnaire. All the nurses that work in a surgical trauma unit could participate in the mindfulness-based intervention. We did exclude any float pool nurses from Focal survey, but they were eligible to participate in mindfulness-based activities. During the shift huddle, mindfulness-based intervention were completed for 5 minutes. We used meditation, deep breathing exercise, and self-compassion exercise. We keep themes familiar to nurses, such as meditation of deep breath, heart rhythm, and need of oxygen. Nurses were asked to choose a quiet and comfortable position in their chair. They would gently close their eyes to minimize the distraction and focus on their internal state. The charge nurse led them through the meditation techniques, such as consciously relaxing their muscles starting from the top of their head to the bottom of their toes, specifically paying attention to any area of discomfort or tension. Results from the quality improvement project showed statistically significant improvement in all subcategories of the Focal 5. Nurses reported that mindfulness-based intervention to the shift huddle helped them to cope with work-related stress. They also reported that their participation would benefit their patient because they feel like they are more happy in their professional role. A few nurses were interested to becoming mindfulness champion to carry on the brief mindfulness-based intervention during the daily shift huddle. They were also interested to expanding the mindfulness-based intervention, such as journaling, yoga therapy, art therapy, music therapy, and relaxation. Staff were able to show this result to project to justify the need of mindfulness gen room that was added to the unit. So not only this project was feasible and sustainable, but now it is embedded permanently into the unit culture.